If your sleep is all over the place, or you keep losing your train of thought and your periods are horrendous, fluctuating between flooding and non-existent, you are probably not imagining it. This is exactly how many people describe going through the menopause transition. There are effective ways to help you to feel more yourself again. So I'm Brooke, I'm an NHS obstetrics and gynaecology doctor, and in this video I'm going to make sense of what could be happening to you right now. We'll talk about what menopause specifically is and when it typically arrives, how the perimenopause is different from the menopause. We'll talk about the symptoms that you might notice from day to day and what can actually help with those symptoms and when you should talk to your GP. So let's start with, when can you expect the menopause? Well, there's a lot of confusion because some people think they can't possibly be in the menopause because they're in their 40s, for example. But actually, we need to understand what we mean by the menopause first. So menopause is specifically the point in time when it's been 12 months since your last period. So in the UK, most people reach that specific point somewhere between their mid-40s and their mid-50s, with the average being around the age of 51. Some people experience it earlier, and if it happens to you before the age of 40, it's called premature ovarian insufficiency, or POI. You can work out when you might go through the menopause by asking your mum if you've got a mum around, because often you do follow a similar pattern to the other women in your family. But on the other hand, perimenopause is the lead up to the menopause, but it can start several years before that final period. So that means that if you go through the menopause age when you're 51, you may start experiencing symptoms in your mid-40s. So when your hormones begin to fluctuate more erratically, so your symptoms can come and go in waves. You might have a period of time when you've got really bad sleep and hot flushes and they can go away again. And during that time, you may still be having periods. So the menopause is actually confirmed once you've gone a full year without that period. So that hormonal stop-start can leave you feeling fine one week and completely out of sorts the next. It's really difficult to deal with. So what are the actual symptoms of the menopause? Well, there's well over 60 symptoms now described in the literature. Now, not everyone will have many of the symptoms. They may not have all of them at once. They may not all arrive at the same time, but it helps to know what can actually be due to the menopause so you can talk to your doctor about it. The commonest issues that I hear in clinic that are related to the menopause can be period pattern changes, hot flushes, night sweats, sleep that won't settle or brain fog, and difficulty finding words, and also having mood shifts. You might be feeling irritable and anxious and low in mood one day and then completely fine the next. Also, joint and muscle aches. People often put down to getting older, but it can actually be a result of a hormonal change in the menopause. Also, headaches and just feeling low in energy or fatigued a lot. Now, around the vulva, the vagina and the bladder, people often notice vaginal dryness or soreness with sex, potentially itching or burning, or experiencing a new urgency to pass urine, or finding that you might be leaking when you didn't before. Now, not all of those symptoms are directly due to the menopause. You could have prolapse or incontinence separately, but they can be worsened by the changes of the menopause. You might also notice some of the more unusual menopause symptoms that are very real, but people don't often talk about or attribute to the menopause. For example, pins and needles or tingling in your hands and feet, having a crawling or itching sensation on your skin, getting electric shock zaps just before you get a flush, palpitations that come and go, changes in your taste or getting a metallic taste, dry eyes. Also, people mention a ringing in their ears, burning in their mouth, sudden intolerance, so you can't take being hot or being in crowded rooms. Or some people have an increased sensitivity to caffeine or alcohol. So if any of these symptoms feel severe for you, if they're persistent or if they just feel out of keeping with your usual health, it is a good idea to be documenting these symptoms and then take them to your GP so we can potentially rule out other causes and support you properly. Now, whilst I think it is very important for men to know about the menopause anyway, to be the best support system for our partners, it's also important for others to understand that menopause can have a very real impact on sex and your relationships. As the estrogen level falls, the vaginal lining becomes thinner and it's less elastic, blood flow reduces and natural lubrication drops. So the pH of the vagina can rise, shifting your microbiome, and all of these things can make the tissue more sensitive and prone to little tears in the skin, itching or burning. The urethral lining is affected too, because you can get urgency or frequency symptoms. You need to go to the loo all the time. All of these things can leave sex feeling dry or uncomfortable or stinky, if you even have the desire at all, which can also be affected. Now, if you are having issues with sex related to the menopause, putting estrogen directly into the vagina can replenish the tissue locally, and it's got lower absorption of the hormones than if you take it, for example, as a pill. So taking that vaginal estrogen can improve the lubrication of the vagina, the resilience with sex, and can transform your comfort, letting you enjoy sex again. On top of the changes to the vagina itself, libido can often fall during menopause, partly because of a low estrogen, also because you may not be able to sleep or you may not be able to concentrate, and you may just not feel up to it all the time. If sex is an issue during the menopause, I recommend adding a vaginal moisturizer a few times a week, using lubricants for sex, communicating well with your partner about how you feel about sex, and if low desire is also wrapped up with poor sleep, constant flushes, then treat those symptoms first. For example, take HRT if it's appropriate for you and if you've discussed the risks and benefits with your doctor, because it often does improve intimacy as well. And if you ever notice bleeding after sex, especially during the menopause or after it, definitely get checked. So what treatments can you have to help your menopausal symptoms? Well, the treatments should match your symptoms as well as your preferences and your lifestyle. Hormone replacement therapy can be very effective for hot flashes, night sweats, broken sleep, mood changes. The type and the route of HRT can be tailored with your doctor. So if your main concern is vaginal dryness or soreness or sex, as I've already mentioned, a low-dose vaginal estrogen might be right. But for most symptoms, especially if you have more than just the vaginal symptoms, you may wish to try systemic HRT, which means that you take a tablet or a gel or a patch to give you the HRT. Now, there are non-hormonal medications that can take the edge off some of the symptoms if HRT is not right for you or you don't like the sound of it. And they particularly can help with, for example, hot flushes. Now, alongside this, the foundations still matter. So regular movement, maybe reducing your alcohol or your caffeine intake, a consistent wind down routine, and improving your sleep hygiene, so not using devices just before bed, for example. These small, sustainable lifestyle changes can actually really significantly improve menopause symptoms. So, one of the biggest myths that I hear about the menopause is that you can't start HRT because you're still having periods. It's not true. If your symptoms are affecting your day-to-day life, even if you're still having periods, perimenopause is a perfectly good time to start the treatment. It can help with your hot flashes, your mood changes, your sleep, even if you're still having menstrual cycles. So the first thing we should do is keep a symptom log for 6 to 8 weeks, longer if you need to. So you write down all of your cycles, so how long our periods are, how heavy they are, but also any other symptoms that you're having. You can take that to your doctor and talk through the options. And together you can decide whether systemic HRT or local estrogen or non-hormonal choices are the best approach for you. So how can you get the most out of this appointment? Well, bring your symptom tracker, your cycle dates with you, and then begin with the one symptom that you might want to improve the most, because we can't cure the menopause. We can often target the symptoms that are bothering you more. So perhaps sleep is your issue, or the hot flushes, or discomfort with sex. Talk about which ones you really need sorted and which ones don't bother you as much. And you can talk about the risks and the benefits of the different types of HRT, whether referral to, say, someone like a pelvic health physiotherapist or a psychosexual therapist might help with those specific issues. The bottom line is you don't just have to put up with these menopausal symptoms. There's a common belief that nothing can be done for your periods until your periods have stopped, or that you just have to put up with the menopause because it's something everyone goes through. But you don't have to wait. You should get the treatment that you need at the time that you need it. And when it comes to the leaks or urgency symptoms of the bladder, they are common. I'd recommend daily pelvic floor exercises, maybe bladder retraining, because they can make a real difference, and definitely treating any vaginal symptoms with vaginal estrogen. But if you still have issues with bladder leaks, or you're running to the toilet all the time, speak to your doctor. They might recommend pelvic health physio or something else. So if you're really struggling with the symptoms of the menopause, you're not losing your mind, you're going through a real hormonal transition that is highly manageable as long as you've got the right plan. So talk about your symptoms, talk about which is your priorities, and tailor the approach that fits your life the best. And if something has changed for you, or you're worried about something like bleeding after the menopause, please reach out, because help is there for when you need it. So which of the menopausal symptoms bothered you the most, and did you find anything that actually helped?